Hello, and thank you for your interest in a position as an RN Telephonic Care Manager with Humana. This realistic job preview will introduce you to the most common tasks, challenges, and rewards of this work so you can decide if the position is a good fit for you. Our patients are Humana members. We provide comprehensive one-on-one health and well-being support over the phone for our members with the goal of helping them achieve independence. Using our clinical judgment and motivational skills, we identify gaps and barriers to help members develop and achieve their health goals. We help them understand their health conditions, options, and provider instructions while asking probing questions to identify risks and complications. Our work and goals are meaningful and intentional. We enable our members to have more healthy days at home, fewer hospitalizations, and reduction in their cost of care. Next, let's meet some of our nurses to learn more about their experiences in the job.
I talk with my members about how to really just better their health. I mean, we here at Humana, we're here to help our members achieve lifelong well-being. You know, I'm just whatever my member needs at that time. The first thing I do is I try and look at, maybe what we talked about the last time. I look at our care plan. You know, what was our goal? What did I want that member to achieve from the last time that I called them?
After identifying those gaps that the members may have or that member may have, at that point we, with permission, ask the member what goal would they like to work on? What would they like to improve? Maybe the member does not know why he's taking this medication that's relating to congestive heart failure, and that's where we coordinate with the primary care physician, get further insight on what the member should be taking. Is this the right medication? How often they should be taking it? And the member, with his permission, tells me this is what I want to work on next call.
You have to really go with your listening skills and be able to listen to a member's subtle and non-subtle signs to help members work on their healthcare goals. One of the key components is building rapport and trust with members. So they'll actually pick the phone up the second, the third, the fourth time and work with you on helping them achieve the goals.
A lot of people you can click with just talking to them. When I go through my surveys and stuff, I try to make it feel like more of a conversation instead of like I'm asking questions, and I think that really helps them open up, and I feel like I can get maybe more out of them, feeling like they're just talking to me about their health instead of me just calling saying, okay, question 1, question 2, what question 3.
There's things that we address like falls and emergency room visits that are required for us, medication changes, difficulty getting medications filled. There's certain surveys that we have to do that are required on a time frame. So some of those can be a little challenging when you know you have 10 more members you really need to call that day. You only have 8 hours in a day, so you have to be mindful of your time management, your prioritization.
I had a captive audience at the hospital. They were coming to me and they were ready to listen to what I had to say as far as education, information, instructions. Here it's different in that it is based off telephonic, and they had to learn to trust me in order and want to engage in this program and to realize the benefits of the program.
Autonomy is a big thing. You're the one that knows the member, you're the one that's working with the member. You, as the nurse, have the ability to make the decision on where this member is.
Working from home is definitely comes with its perks. It definitely does. But we're not sitting at home eating bonbons and talking to people on the computer all day long, and that's not, there are expectations. We are monitored with our calls. We are monitored with our time management and how we spend our time management.
Yeah, working at home, it was kind of funny. I had a lot of people say, wow, my gosh, that's going to be so great. The errands that you're going to be able to run during the day and the housework you're going to be able to get done, and not the case. There's definitely benefits not having that commute, of course, and you can come up and work in your PJs. That time that I would normally spend on getting ready for the commute to work, getting up early to get ready, plan for the drive-in, I can take that time and take my dog for a walk in the morning, have a smoothie breakfast, and then start my day. That's a big benefit, to be able to walk up the stairs and avoid any weather and come right up to your office, and you have everything, here at home. But however, it is work, and just because my office is at home, when I come into my office, I'm at work.
I had a member who called in and she had a headache off and on for weeks. She hadn't gone to the doctor, so we made arrangements for her to be able to go to her doctor. Blood pressure was really high, but she couldn't afford a blood pressure cuff to check it at home. So through resources, I was able to find a place that would mail her a blood pressure cuff. It was for free. I was able to get her into the doctor to teach her to say, you need to check your blood pressure, you need to take this medicine daily. And once she started doing that, she realized she felt better, and it made a difference in her life.
I had a member recently tell me, Rhonda, thank you for coming into my life. And that just touched my heart. He's going through a difficult year, a lot of health condition changes, and he was very thankful for giving him, he said, the advice to help him to be better. So when it comes down to that and helping someone, help get that transportation to their appointment, and they're so thankful, or finding that resource that they needed, or understanding something about their condition that was a light bulb aha moment for them that made a significant change in their health, that's what makes it worthwhile.
Just a few more things before we conclude. In part 1 of your realistic job preview, you met some of our nurses and learned about their experiences with their position at Humana. The work also requires nurses to be skilled and comfortable using computers and other technology. Throughout each day, we are constantly navigating our computer resources, often working with multiple programs simultaneously. Before, after, and even during a call, we toggle between different applications to look up information, locate resources, and document our member interactions. Finally, as in every good business, our work performance is tracked and monitored to ensure we are continually adding value and providing superior service to our members. We are responsible for delivering care to as many members as we can each day, and there may be times when our member needs are escalated, requiring we work beyond our regularly scheduled hours. Many of our calls are also monitored and scored for quality and compliance with rules and regulations, which helps ensure we're driving the right clinical outcomes. At Humana, we are committed to improving the lives of our members and providing everyone with personalized attention and guidance along their well-being journey. We hope this information is valuable as you decide if this position is right for you. Thank you for watching, and we wish you the best wherever your career takes you.